Pancreatic cancer is a serious and often deadly form of cancer that affects the pancreas, an organ located behind the stomach. The pancreas plays a crucial role in digestion and blood sugar regulation, producing enzymes that break down food and hormones like insulin. Unfortunately, pancreatic cancer is often diagnosed at a late stage, making it difficult to treat effectively. In fact, the 5-year survival rate for pancreatic cancer is only around 10%, making it one of the deadliest forms of cancer. That's why it's crucial to be aware of the warning signs and symptoms of this disease. This video will discuss 10 common warning signs of pancreatic cancer that you should never ignore. By being informed and vigilant, you can increase your chances of early detection and successful treatment. Remember, knowledge is power when it comes to your health. Sign 1. Dark urine. Dark-colored urine may seem harmless at first, but it could signal something far more serious happening inside your body. In pancreatic cancer, tumors can block the bile ducts, causing a buildup of bilirubin in the blood. This excess bilirubin can darken the color of urine, making it appear brown or tea-like. Since the pancreas shares ducts with the liver and gallbladder, any disruption can affect the excretion of waste. Dark urine is often accompanied by pale stools and yellowing of the eyes or skin, which reinforces its importance. This condition is called coluria and is linked to obstructive jaundice. Dehydration and certain medications can also cause dark urine, so it's crucial to consider other symptoms. If the discoloration persists for more than a few days, it shouldn't be ignored. Monitoring your urine color can offer early clues to underlying health problems. When in doubt, consult your doctor promptly for a full evaluation. Sign 2. Oily stool that floats. When your stool looks greasy, floats, or has a particularly bad odor, it could be a sign of fat malabsorption. Pancreatic cancer can impair the pancreas's ability to produce digestive enzymes, making it difficult to break down fats. This leads to undigested fat being excreted, resulting in a condition called steatorrhea. The stool may appear light-colored, bulky, and difficult to flush. Floating stool is often a direct result of the fat content making it less dense. This issue can also cause bloating and abdominal discomfort due to poor digestion. Fat-soluble vitamins like A, D, E, and K might not be absorbed efficiently. Over time, nutrient deficiencies can develop, weakening your overall health. While occasional changes in stool can be harmless, persistent greasy stool should raise a red flag. If these symptoms are new and unexplained, especially if accompanied by weight loss or pain, speak to a healthcare provider immediately. Sign 3. Jaundice. Jaundice is perhaps one of the most visible and alarming signs of pancreatic cancer. It causes a yellowish tint in the skin and eyes due to excess bilirubin in the bloodstream. Pancreatic tumors can block the bile ducts, preventing bilirubin from being excreted properly. This can happen even in the early stages of the disease, making it a critical warning sign. Alongside yellowing, you may notice itchy skin, dark urine, and pale stool, forming a symptom cluster. Jaundice can also make your skin feel dry and irritated. It may progress slowly or appear suddenly depending on how the tumor grows. In some cases, it's the first symptom that prompts someone to visit a doctor. If you or someone close to you develops these signs without an obvious cause, it's important to act quickly. Jaundice can indicate more than liver trouble. It might be pointing straight to your pancreas. Sign 4. Itchy skin. Itching is a lesser-known but impactful sign that your body may be trying to tell you something. In pancreatic cancer, bilirubin buildup not only causes yellowing but also triggers intense skin irritation. This kind of itching can be persistent and often worsens at night. It's most commonly felt on the palms, soles, and arms, but it can affect any area. Topical treatments might offer temporary relief, but they don't address the root cause. Unlike common skin conditions, this itching doesn't go away with moisturizers or antihistamines. It often comes with other signs like jaundice or fatigue. Patients sometimes scratch so much that they develop wounds or bruising. Don't brush off prolonged itching, especially when combined with digestive symptoms or skin color changes. Always consult a doctor if this symptom persists without a clear dermatological cause. Sign 5. Blood clots. One of the more surprising signs of pancreatic cancer is the development of unexplained blood clots. Cancer can make the blood more prone to clotting, a condition known as a hypercoagulable state. You might notice swelling or pain in the legs, which could be a sign of deep vein thrombosis, or DVT. Clots can also travel to the lungs, causing life-threatening pulmonary embolisms. Symptoms like chest pain, Difficulty breathing or coughing up blood require immediate emergency care. Clots can appear even before a cancer diagnosis is made, which makes them an important early indicator. Unfortunately, they're often overlooked or misattributed to less serious causes. If you have a clot with no obvious reason, no surgery, injury, or prolonged inactivity, it's time to dig deeper. Early diagnosis of pancreatic cancer through these indirect signs can sometimes make all the difference in treatment outcomes. Sign 6. Swollen gallbladder. A swollen gallbladder may be silently pointing toward pancreatic cancer. When a tumor obstructs the bile duct, bile can back up and cause the gallbladder to swell. This swelling might not cause pain right away, but over time it can lead to tenderness or discomfort in the upper right abdomen. Imaging scans like an ultrasound or CT can often detect this enlargement even before other symptoms show. Doctors may find it during an exam as a firm lump beneath the rib cage. A swollen gallbladder can also contribute to nausea, vomiting, or fever if infection sets in. Though not exclusive to cancer, it's often found in those with pancreatic or bile duct tumors. If you're experiencing abdominal pain along with other digestive issues, it's essential to investigate further. Gallbladder problems tied to pancreatic issues need urgent medical assessment. Sign 7. Sudden and unintentional weight loss. Losing weight without trying is always a cause for concern, and in the case of pancreatic cancer, it's a frequent early symptom. Tumors can affect digestion by interfering with enzyme production, leading to poor absorption of nutrients. This means you may be eating normally, but not gaining any nutritional benefit. Rapid weight loss is defined as more than 5% of body weight lost in a short time, such as within 6 months. This could mean dropping 10 pounds or more unexpectedly. Cancer also consumes a lot of the body's energy, further contributing to weight loss. You may also experience fatigue, weakness, and a decline in muscle mass. Sometimes this symptom is dismissed as stress-related or age-related, which can delay diagnosis. Always take unexplained weight loss seriously, especially if it's accompanied by fatigue, pain, or changes in appetite. Sign 8. Loss of appetite. Loss of appetite can be more than just a passing phase. It might be an early signal from your body. Pancreatic cancer can affect hormones that regulate hunger, such as ghrelin and leptin. Additionally, tumors near the stomach can make you feel full quickly, even after eating just a few bites. This results in progressively eating less and feeling more fatigued. Over time, this contributes to both weight loss and nutritional deficiencies. Some patients also report a strong aversion to foods they used to enjoy. Others may experience nausea when trying to eat. If this symptom becomes consistent, it's not just about lack of interest in food, it may be a warning sign. Coupled with other digestive complaints, it warrants a full medical workup. Loss of appetite, especially when prolonged, should never be ignored. Sign 9. Nausea and vomiting. Feeling nauseous or vomiting without an obvious reason is something you shouldn't overlook. Pancreatic tumors can press on the stomach or intestines, making digestion uncomfortable. This can result in a constant sense of nausea or even episodes of vomiting after meals. Some patients describe a bloated or tight feeling in their abdomen before throwing up. Others notice this symptom worsens after fatty or heavy foods. In addition to being distressing, frequent vomiting can lead to dehydration and electrolyte imbalances. Nausea may also reduce appetite, compounding the issue of weight loss. It's important to rule out other causes like food poisoning or ulcers, but if this symptom sticks around, dig deeper. Pancreatic cancer-related nausea usually doesn't respond well to typical remedies. If over-the-counter solutions don't work, speak with your doctor. Sign 10. Abdominal and back pain. One of the most common and persistent signs of pancreatic cancer is unexplained pain in the abdomen or back. This usually starts as a dull ache in the upper abdomen and may radiate to the middle or lower back. The pain can become worse after eating or lying down. As the tumor grows, it may press on nearby nerves or organs, intensifying the discomfort. Many patients describe the pain as constant and gnawing rather than sharp. It can interfere with sleep and daily functioning, reducing overall quality of life. This symptom is often confused with ulcers, gallbladder disease, or back issues. However, when paired with other signs like jaundice or weight loss, it should be taken seriously. Persistent abdominal or back pain deserves immediate medical attention, especially when traditional treatments don't help. Pancreatic cancer is one of the most challenging forms of cancer due to its subtle symptoms and late diagnosis. However, by staying informed and alert, You can spot potential warning signs early. From dark urine to abdominal pain, these symptoms may seem minor on their own, but together can tell a bigger story. If you or a loved one are experiencing more than one of these signs, don't delay a medical evaluation. Early detection can significantly improve the chances of successful treatment. Always trust your instincts when something feels off in your body. Remember, you don't need to wait for severe symptoms to take action. Prevention and awareness are your first lines of defense. So now let me ask you, have you or someone you know ever experienced any of these symptoms? Share your experience in the comments and let's raise awareness together.